What inspired me to do medicine was actually my grandfather and his journey through his cancer. So he was diagnosed with late-stage prostate cancer when I was young. His stories of the physician that was treating him really inspired me to join medicine. It was unfortunate that by the time his cancer was diagnosed, the outcome was not good already. But he used to tell us stories of the physician who he was being managed by, and that he used to tell us that the physician treated him very kindly, and he felt that the physician was doing everything he could for my grandfather. And that gave my grandfather a lot of confidence and also a lot of reassurance that he was receiving the best of care. And that is what first inspired me to join medicine. Later on, as I progressed through medical school and also in my junior traineeship, and also as along the way, we are seeing brilliant physicians who are very smart and able to make difficult diagnoses. But actually, the most outstanding of physicians were those who were able to inspire in the patient a confidence, and that the patients knew that they have this compassionate collaboration with them to work together with them, to work for them, to make them feel better. And that actually influenced the patients to improve, and that actually influenced the patients to gain trust in the physician and be able to work together, the physicians, to work towards a better outcome. And that seemed to affect the outcome very much, and that hence shaped my practice a lot. At our clinic, the Heart Specialist Clinic Singapore, we actually have a group of doctors working together, and we have different abilities, different subspecialties, and different knowledge set, where collectively we can work together to manage a really broad spectrum of cardiac problems. Where I lie in this ecosystem is that I'm an electrophysiologist or a heart rhythm specialist and cardiologist. And essentially, I manage heart rhythm disorders or abnormal heart rhythms. So the patients that I manage either have slow heart rhythms or fast heart rhythms. And essentially, we try to manage them with medication. Some patients require implantation of pacemakers or defibrillators. And some patients with abnormal rhythms or short circuits within the heart, we actually have to list them for procedures where we insert a catheter into the heart and try and burn away or shock away these abnormal rhythms in order to stabilize the heart. So a patient with a heart rhythm problem can present in very many ways. They can experience different symptoms. So usually patients with a fast heart rhythm and an abnormal heart rhythm, they might feel palpitations, which means an abnormal sense of the heartbeat, be it fast, be it very strong. Some of them may feel chest pain, shortness of breath, or some patients may even faint. Patients with slow heart rhythms wise, they actually, because of the very slow heart rhythm, they might feel tired, lethargy, they might feel a sensation of giddiness or sometimes even near fainting, and if severe enough, they may actually totally lose consciousness. Invariably, some people do find that when they take their blood pressure, the heart rate on the monitor appears very slow, or if they feel their pulse, indeed, is less than 60. Now, we encourage people who have this type of symptoms to seek medical attention, be it with a family physician or with us if they're willing. But naturally, not every single patient with these symptoms have a definite medical problem. So no need to worry too much. But it's natural that we will advise them to come and seek medical attention to make sure that there's nothing sinister or worrisome of their symptoms. So for a patient who arrives in our clinic, be rest assured that we'll try our very best to establish a diagnosis and also make sure that if anything is wrong, it's detected. So essentially, it will be important for the patient to bring forth their previous medical records, as it will give us an idea of what other investigations have been performed prior to this. Also, they will expect a chat asking about their symptoms, about how they feel, and to a certain extent, how this goes will be there might be other questioning to help us calm down and figure out what's going on. There will also be a physical examination, first of all from the cardiovascular system with probably a stethoscope. And then after that, we will try to assimilate all this information and decide what further tests need to be done or whether any tests need to be done to begin with. And hopefully at the end of this, we can come to a diagnosis, a conclusion of what the patient has. So we do provide quite a fair bit of services in our clinic because the cardiac disease spectrum is quite broad and we need many investigations to figure out what's going on. So some of the more common investigations that we perform as a cardiology unit are the electrocardiogram, where we look at the electrical activity of the heart. We can perform an echocardiogram, which is a simple ultrasound of the heart, where we look at the heart function, we look at the heart structure, and we see whether there's any abnormality or weakness of the heart or leakage of the valves, and also we check the pressures within the heart. We can also perform stress tests, be it a treadmill stress test with an ECG only, or a treadmill stress test with ultrasound at the same time, or sometimes we can use medication to simulate exercise. And all these goes into stressing the heart in order to detect whether there's any blood vessel blockage or to trigger off any irregular heartbeats if we are looking for them. Otherwise, beyond our clinic's investigations, we also do partner with some radiology centers to do CT scans of the heart, where we look at the blood vessels to look for any blockage. And in certain patients, we also require MRI scans of the heart to look for whether there's any abnormality in the heart muscle. Treatment-wise, well, there are a couple of invasive treatments that sometimes are necessary for patients, as much as we like to avoid it. So in patients with blood vessel blockage, what we can do is a coronary angiogram to look at the blood vessels by inserting a catheter into the heart. And if there's significant blockage, we will definitely attempt to deliver a balloon to open up the blockage, and of course beyond that to stent and open up the blockage. Patients with slow heart rhythms or abnormal heart rhythms sometimes require implantation of a pacemaker or a defibrillator, and that can be done in our operating theatre or also in the lab. And patients with short circuits in the heart, irregular rhythms such as atrial fibrillation, which is one very, very common irregular heartbeat, we can do an ablation procedure where we insert catheters from the leg into the heart via the blood vessels, and then we use heat energy or shock energy to eliminate these short circuits, and hopefully we can eliminate the source of these irregular heartbeats. So we take a lot of pride in keeping up to date with the latest treatment, the latest guidelines and the latest evidence, in hope that with this knowledge we can treat our patients to the best of our ability. In addition to that, we place a lot of emphasis on letting the patient know their diagnosis and explaining their condition to them. Also, we treat each patient as an individual, and that treatment must be in line with their personalities, their expectations, and also we tailor our treatments to work together with them to achieve the best of outcome. My advice to patients is that how you live now and how you manage your body affects your heart health in 10, 20, 30 years to come. So it's very important not to neglect your body, thinking that you can always start healthy living tomorrow or delay treatment and that you will be as effective. This starts as soon as possible in order to maintain your healthy heart in due time to come. So we at the Heart Specialist Clinic are located a stone's throw away from Orchard MRT. We are located at the Mount Elizabeth Medical Centre, level 14, just behind the Paragon Shopping Centre. So we are easily contactable via phone and also via our website. If should you encounter any problems, please do not hesitate to contact us.